Very good evening to everybody. Welcome to this super special episode number 60 of Eclectica. This is super special for two reasons. One, it is number 60, but more special because today I have a gorgeous and enormously fabulous guest with me, Dr. Isabel Rambob, and she is the president of the American Association of Women Dentists. So, let me introduce my guest and then you will meet her in person live right here and you can interact with her as well. And we are talking on interpersonal skills today, and it is very important. And let's see what we have in bag. So, as the president of the American Association of Women Dentists, Isabel aims to honor the legacy of women leaders before her, inspire young girls from underrepresented groups to pursue dentistry, support the well being and professional development of women dentists, and advocate for women dentists in leadership roles. She is a faculty member at the University of Maryland School of Dentistry since 2009, and currently she teaches behavioral dentistry after teaching treatment planning for 5 years. She served on over 50 committees across campus, and currently she is a member of the Umbrella Advisory Board, the President's Council on Women, and the Center for Global Engagement Advisory Committee. She is honored to be the inaugural recipient of the 2021 Umbrella Person of the Year Leading the Way Award. As the founder of Rambob Training Services, Isabel helps women dentists unlock the power of strong interpersonal skills to strengthen teamwork, increase case acceptance, and improve patient satisfaction. Dr. Rambob has created the RTS Interpersonal Skills Framework to guide women dentists and their dental teams to work on interpersonal awareness, professional presence, cultural awareness, assertiveness, team building, conflict management, patient engagement, and online presence to foster effective communication among their teams and with patients. So, we will not waste any more time, and I will invite Dr. Isabel right here in the studio. Very good morning, Isabel.
Dr. was mommy. I gonna hire you to always introduce me. This has been the best introduction I have ever. Thank you so much. Thank you so much for having me in your show. I'm really excited about it to really engage in the conversation with you and the audience and take questions and really discuss about the importance of interpersonal skills and what the new dentists need to learn and develop to be successful in their careers.
It's an honor and privilege to host you on this show and on this special episode because I just touched 60. Hopefully, I can continue more episodes after this. And
You
I'm quite
will. You will.
thank you, Isabel, for being here. And I know you are very busy, but then it's a really absolute pleasure. So today I have a lot of questions to ask you because that is my duty at this moment, and I think you will have. I mean, we are all here to learn from you. Uh, well, so Isabel, if you can briefly tell us that how you got into dentistry per se, as well as in this kind of training coaching, so agenda, how could you, I mean, how do you do all these things together? So I would like to understand your story first, and then I think I will jump on to my questions.
Sure. And again, thank you so much for having me on your show. It's a pleasure to be here and join your audience. Um, I'm based in United States, the state of Maryland, close to Washington, D.C. I'm originally from Brazil, where I got my degree in Doctor of Dental Surgery. I practiced there for a couple of years as a general dentist. And I decided to move to US and start all over again in a new country, new culture, new system, new language, because all my training was in Portuguese. So I have to relearn dentistry in English. But I fell in love with the profession. I love to help people, and I think healthcare is such a calling to be able to help people, to help them restore their health, and how it's important to educate not only the lay population, but other healthcare professionals of the importance of oral health to the overall health. So when I came to US, my original plan was to get my credentials, get my license here, and be able to practice. But life sometimes will take turns. That is not me. It's great to plan, but I think it's also important to be open to opportunities. And I always say, like, no matter what I'm doing, I'm always exploring what else can I be involved with. So I was doing my residency program. So I decided to, there are sort of different pathways to get your license here. And it's not the topic of our discussion, it can be a whole episode just about that. But the pathway that I chose was to do advancing training in general dentistry. And I was doing my training. I got an offer to join University of Maryland School of Dentistry, which is the first dental school in the whole world. It was founded
Right.
in 1840. And I have been there for almost 15 years. I fell in love with teaching. And it's sort of a good segue because when I start teaching behavioral dentistry, that is the patient management, is not the technical part of being a dentist. Really involves with the interactions you have with your patients, with your team, with your colleagues. And I was like, well, I saw the need to also not only help the students, but support my colleagues who are struggling with some of the interpersonal skills that are so relevant to be compassionate, caring dentists.
Thank you. Thank you. That is a very inspiring journey. And oh my God, I mean, you came from all the way from Brazil and you relearned dentistry. I mean, hats off to you because it is very difficult to position you again, after a certain kind of training and absolutely into a new culture and in a new country. And today you are the president of the American Association of Women Dentists. I mean, this is something which inspires many of us who all look up to you. So and as you said, Isabel, that when you started teaching behavioral dentistry, you came to know about patient management or team building stuff. So from there, I think we at least, I don't know about US curriculum, but in India also we do not have such a chapter inside our education system. So it's not only in dentistry, but in any other curriculum, any other branch, that way. And I think it is a very important aspect that we should take care of. So just to make things a little bit more focused, and since you are a coach in this domain, my question to you is that when it comes to interpersonal skills, there are a lot of facts or myths, or some people think, oh, this is not necessary, it's kind of, it's okay, we are doctors or we are dentists. So my question is that, in your opinion, how important are interpersonal skills for dentists? What do you think on
I
this?
love this question. And one of the challenges I have teaching behavioral dentistry, and every time I mention the name of my course,
Mhm.
every single person, no matter if it's a lay person, if it's a dentist, is a dental educator, behavioral, what is that? So I have to explain what is the course is about, because I don't think we teach behavioral sciences in different ways in different schools, but I'm
Right.
not familiarized that any other school in the US has the behavioral science under the umbrella of a behavioral dentistry course, which I'm so honored to be the course director of this course
Mhm.
for over 5 years. And one of the challenges I have teaching this course to ear to dental students here in the US, because it's pre-dental, it's pre-clinical course, it's a pre-clinical course. So students are not in clinic interacting with patients.
Hmm.
They cannot quite understand the relevance because they still are focused on learning the technical skills. They want to learn how to do the prep, how to pull a tooth, how to do the dental procedures.
Hmm.
And when So I see that after they complete my course and I meet them in the hallway, in clinic or something, I see that I can tell they appreciate the course now because they see the relevance of it. And when you think about dentistry and healthcare in general, we are take care of people.
Right.
It's not just a diagnosis. It's not a medical dental case.
Mm.
It's not your cardiac patient, it's not your perio patient, it's not your endo patient, it's a person. And I
Correct.
even have a saying that behind every diagnosis, there
Mm.
is a person who wants to be heard, want to be valued, and want to be respected. So, and as human beings, when we encounter people, okay, you might be drawn by someone attractiveness and titles and experiences, but end of the day, the impression you have of the person is how they make you feel. Is the
Mm.
personal interaction. If they listen to you, they engage with your conversation, they're
Mm.
attentive to your needs. And of course, I'm not saying that the technical skills are not important, your clinical skills, obviously. But I think we are so emphasizing on the technical part of dentistry and not really focusing on the interpersonal skills, how to build a rapport with patients, how to build a team, how to make that every member of your dental team they feel important. And I used to find what is one of my assistants when she introduced herself, I'm only the assistant. I said, don't you ever say that. You are the assistant, and I really value, appreciate you. I cannot work without you. If you're sick,
Correct.
I'm gonna call sick as well. So it's the nature of being human beings that
Mm.
we crave connection. And when we talk about dentistry, particularly, if you think about it,
Mm.
typically people don't wake up in the morning and they look on the calendar and they're like, oh my God, I'm so excited. I have a dental appointment today, right? So typically people go, right? But there are a lot of people that they have anxiety, they have
Yes.
fear, that going to a dental appointment is really a journey for them. And okay, you can be a brilliant dentist, technically speaking, but
Mm.
if you don't know how to make that patient feel heard, respected, and that you can show empathy and you can show compassion, is a
Mm.
disservice. So it's why interpersonal skills are so important, not only in dentistry, but particularly in healthcare, because
Yes.
we are dealing with people in a very fragile state. They are sick, they are in pain, they are dealing with some kind of illnesses. So, one more reason that we really have to emphasize the importance of interpersonal skills in healthcare and in dentistry.
Thank you. Thank you so much for that, extensive explanation in a very simple way. And it's it's a practical thing that you actually told us, and which is, very nicely ignored. So, well, in this context, Isabel, we would also like to know about something that you do very passionately apart from your all these dentistry, being a professor. I don't know how you manage so many things. I don't know that. But
Time
then,
management, one of the interpersonal skills.
oh, wow. Yeah. So I think we need another several episodes to talk on each of these items. It is very important. Well, so can you tell us what exactly was your inspiration in starting Rambo training services, and what exactly you do in the under this banner of the Rambo training services?
So, what inspired me? I always was fascinated about public speaking.
Okay.
And although nobody believes, I used to be a very, very shy. child. And people are like, you shy? Never in your life. I used to be a very quiet, shy child.
Mm-hmm.
And I was sort of like,
Mm-hmm.
polished by the fire. So I get opportunities to do public speaking. I was so nervous, and more you do, better you become. And I became so passionate about public speaking. And I
Mm-hmm.
want to do this in a more formal way. And I was like, why not to start Rambob training services? And I provide training, I do speaking, and also I do coaching because I think it's really a good combination because you do a talk and people get like, oh my God, I really want to learn more. And then they might hire you to do a training for the team. And then they wanted to do a one-on-one. They want to go deeper. So I think that if I was just doing the public speaking of offering the other services, I was
Mm-hmm.
not really closing the circle. So this is
Correct.
why I decided to start Rumba training services. And to all entrepreneurs out there, it's just it take guts to start it. Is awesome. The flexibility. One of the thing is like is a different is a very different dynamics being a faculty member and be an entrepreneur. And I love being both because when you're part of a organization that is a whole structural, settings there that if you have an idea, you cannot just like, sure, I'm gonna implement it. You have to discuss with the chair, with the dean, and with your business, whatever idea you have. It's just up to you to implement or not. So I love this flexibility to be able to create different programs, create different talks, create different, and really customize my services to the
Mm-hmm.
needs of my clients. So I really, because usually when you have a list of topics, you have the learning objectives. I
Yes.
really leave open because I customize the learning objectives based on the needs of my audience and based who my audience are. Because if you have a group of dentists,
Mm.
different groups of dentists, we have different needs. So
Yes.
initially, and it's also I have learned a lot since I started up training services
Mm-hmm.
and really reinvent myself and the business.
Mm.
And don't be afraid to change. If something that didn't work, it's okay to change. So when I first started, because I love to do interprofessional collaborations, I really enjoy work with interprofessional education, collaborative practices, working with other healthcare professionals. Um, we learn so much and also teach them about dentistry. So
Mm.
because of that, when I first started Rump Up Training Services, I started offering service to healthcare professionals.
Okay.
Then I realized that it was such a large audience. And when you
Mm.
try to talk to everybody, you're not
Mm.
talking to anyone.
Yes.
Because it's a different way you communicate with a group of dentists, a group of physicians, a group of nurses, and so forth. Then I
Correct.
decide to go back to my basis and focus in dentistry. So it's like, okay, I rebrand myself. I even changed my logo because it
Mm-hmm.
wasn't a tooth, because it wasn't just for dentists.
Mm-hmm.
I want to bring back to dentistry. So I changed my logo. Now it's a tooth. And obviously, right, if you talk about dentistry, you have to have a tooth. And I was offering services to dental professionals.
Right.
Then I realized that most of my clients and
Mm.
most of my audience were women dentists.
Mm.
And I was sort of debating if I should just rebrand again and
Okay.
focus on women dentists. Then I think it's a big sign when you elected the president of the American Association of Women Dentists. I was like, this is a sign. Why I'm struggling. So I
Right.
rebrand myself, my company, and now
Mm.
I focus on women dentists. So, of course, I do talks and speak to mixed groups, but
Right.
my main focus, of course, the principles, what we discussed in can be
Mm.
applicable not only for women dentists, but dentists
Mm.
and other healthcare professionals or people in general. It's just my passion to
Mm.
really support women dentists. So this is
Fantastic.
how I came about now to keep narrowing down They
No,
focus.
I think that's perfect. I mean, you actually told how to build an idea from scratch and how to do branding. That is what you told right now. That is very interesting. And I think, as you said, that you niche down to women dentists, and you also got elected as the president of the Association for Women Dentists. So I think,
And another business is the number of women dentists are just growing.
yes,
So from the business perspective, it's like
yes,
why not tap on that trend that we will have more and more women dentists
absolutely.
in the
And I
future.
think they need more women dentists, or in general women. We lead a life of changing phases every 2 years or 3 years, like, it's something like that. If not that is the correct frequency. But I think, in at every space or pace, these kind of things are very important. How we need to handle, like as you say, the time management. This is something which is very important, which is under the umbrella of interpersonal skills. Because when you are a daughter, you have a different time management. When you are a wife, when you are a mom, you are on career break. So there are a
And
lot
when
of
you're a
issues.
man, that you don't have to worry about sort of things that a
Yes,
woman have to
right.
add to the list of to do things. Yes.
Correct. Correct. So, Isabel, can you just tell me that if somebody, is it like your courses or your services are open only to people in the US, or anybody can, from any part of the world, they can, approach you and get in touch with you for this?
It's the beauty of technology,
Mm-hmm.
right? We met, we haven't met in person. We
Yes,
met on LinkedIn.
absolutely.
We did a Instagram live on my profile. Now I'm doing a podcast, and I offer all my services online as well. So
Okay.
yeah, so it's not, we don't have, you don't have to be necessary in the US.
Okay. And what is that website where people can reach you for this, or they can just see, what your offerings are? Can you please mention that?
Sure. Thank you so much. It's www.rumbuptraining, one word.com. So it's Rumbup Training. So it's
Right.
my last name, Training. And I did that very intentionally. So it's easier for people to
Right. Yeah.
remember because it's
Yes.
my last name. And
Correct.
it's one thing that I think that women sometimes shy away is
Mm-hmm.
to put their names on
Mm.
things. And guys who do is out of hesitation. But women, you don't see as many women using the name for
Right.
business purposes or something like that. Yes. So
So, as you help many women dentists, or per se many people with interpersonal skills, so what experiences did you gather when it comes to mistakes people, when they start learning or when they try to implement? So, what are the common mistakes in the field of interpersonal skills that you have seen people doing? And yeah, so I think that is a question that was running in my mind.
and I love this question because it's not everyone who really asks me this question. And it's so
Mm-hmm.
important. And
Mm-hmm.
I like to deal with barriers, what is the mistakes, because sometimes we focus so much on getting things done and
Correct.
not focus like potential barriers and obstacles and so forth. So I
Mm-hmm.
always like to address that as well. So based on my experience with my clients and observing the trend and the behavior and with the students, three things that I would like highlight that is the most common mistakes when
Mm-hmm.
people try to develop their interpersonal skills. Usually they wait too long to take action. So it's like, okay, and then a light bulb like, oh, I have to address this. I have to, and the foundation of a strong interpersonal skills is a strong communication skills. It's just like communication skills is the foundation. No matter what we're talking about
Right.
in the realm of interpersonal skills. So number one is taking too long to take action. And I
Mm-hmm.
haven't, and people just complain about or don't even take action. Oh, I'm not good at public speaking. I wish. It's like, so do something about it. Get a coach. Put yourself out there.
Right.
Practice. Just create the opportunities. This is
Mm.
another thing. You cannot just wait for the opportunity. You have to create the opportunities, right?
Very.
You have to be out there. Don't
Mm.
be embarrassed. Don't be afraid. Um, no fear of rejection. You're gonna get no's, but it's the only way we're gonna get eventually to a yes. So take action. Number two is really not having a personal inventory.
Mm.
I love to do live polls when I'm presenting,
Mm.
and I have been asked this question: do you have a personal inventory? I would say 90% of the people, they do not have a personal inventory. I don't think they even know what is a personal inventory is, right? So,
Right.
and we do inventories, even unconsciously around the house. Before you go to the grocery store, you do an inventory. It's like, what is missing? What do I need to get from the grocery store?
Exactly. Mm.
So
Mm.
I don't have eggs. I don't have milk. This is checking your inventory in your
Mm.
kitchen at work. If you have to order off supplies in
Mm.
the dental practice,
Right.
right? And the format I use is the SWOT analysis. The SWOT analysis, which it has been widely used in business to do
Correct.
the analysis for organization, we can modify and use for your personal needs. So SWOT stand on SWOT. So S for strength. So you can use a fancy app, whatever, but you can do in a piece of paper. You can use a file on your computer or even on your phone. So
Mm.
you have on a piece of paper and then you label S for strength and you list your strengths. Then W is for your weaknesses. So you list your weaknesses. And then O is for opportunities. What are the opportunities out there? And T is the threat. So you list all of that. Then you decide, because I don't think you have to work in all your weaknesses. There are some of weaknesses, yes. For instance, if you are dentist and
Mm.
you're very shy that you cannot talk to people, you have to work on that. Because as a dentist, you are leader of your dental team. You have to present information to your patient. So you have
Correct.
to work on being more comfortable, because public speaking, not just talking to a group of 1,000 people, presenting a plan, a treatment plan to your patient is sort of public speaking, right? So it's something that is like, well, I have to be good at. There are sort of things like what is the impact of this, how these weaknesses is impacting me? Do I
Mm.
have to work on convert this weakness and strength? Or I
Mm.
can outsource. I can pay someone to do this for me, or I can ask a colleague, or I can refer to somebody else. So you have to be sensible that
Mm.
it's not all the weaknesses that are going to have an impact, and has to be. Sometimes it's just like, I'm not good at that. I'm okay. And I'm going to hire someone to do this for me because
Exactly.
I don't want to get better, because I don't
Mhm.
enjoy doing this. And it's fine. So it's this self awareness. And why
Mm.
it's so important to do this personal inventory. Of
Mm.
course, you want to, but the main thing is the awareness. We live in such a fast paced world that we're not taking the time just to sit with ourselves and just take a moment to really process how we are feeling right now, our emotions, our intentions, the impact of our actions, because you go with the emotions. So number one, taking too long to take action, not have a personal inventory. Number three, not seeking feedback, because sometimes we are not aware how people are perceiving us.
Yes.
It's why you have to be very mindful
Mm.
the difference between intention and impact.
Mm-hmm.
So you might have intention to produce some results, but the impact of your action is completely different of your intention. And people on the receiving end, they will care less about the intention, but they will definitely will be concerned about the impact, particularly if it's a negative impact. This
Correct.
is something that is the most common mistakes that I have been observed. Not taking action timely enough, not having a personal inventory, and not seeking feedback.
Thank you. I think that was huge, and it and the way you explained, I think everybody who's listening to us right now here or who will be watching the recorded version, any person can relate to what you are saying. And sort analysis. I mean, how could you bring a business sort analysis into packed into a personal inventory? I think only Rambob can do this. Isabel can do this. This is amazing. This is
You
just
don't have to
amazing.
reinvent the wheel. Sometimes we just like try to recreate something. We just
Correct.
can adapt something that
Hmm.
is already in existence to
Right.
our needs. So,
Okay. So Isabel, I think we are speaking quite for some time. So now, and I asked about the mistake. So at the with the same passion, I ask you another question that if you can tell some tips or techniques what people who when some people who are now enthusiasts and they really want to improve or they work on this aspect of interpersonal skills, so can you give some small tips or techniques as to where they can start their journey? Because I think starting anything which is new to us
mhm.
uh, is always I think it's a refrain mechanism which happens inside the human mind. So those tips and tricks, I think, will help somebody who is really enthusiastic to start on their journey. So can you please help with that?
Sure. And interpersonal skills is such a broad theme,
Hmm.
involves so many different skills.
Right.
So my suggestion is to be very intentional about what are specific skills that you'd like to develop. Some
Hmm.
people might be communication skills, some people might be organizational skills, time management, resilience, adaptability, right? Negotiation skills, networking skills. So,
Hmm.
number one, I think is to make things easier. And I really like to work with the number three. So,
Hmm.
decide what are the three top skills that you'd like to focus on.
Right.
Because if you try to improve 10 skills at once, most
Hmm.
likely you're going to fail. So, you have to set yourself up for success. And I'm going to give a simple example. Since we are talking mainly to a dental audience and we welcome other, people from different fields but I would give an example in the dental field because we are both dentists and it's what we know, right?
Right.
So let's say you are recent grad and you start working this dental practice and you feel that you're not communicating well with your patients the way you wish you could, with the permission of a patient, with this really very expensive equipment that you have to really get, maybe do a fundraising to get with your phone, right? Your smartphone, all your smartphones as a camera, with permission with of your patient. Record yourself, interact with couple patients, and watch yourself and do a self critique. So this is something that is very simple, cost effective, that you'll be able to, in a very practical way, analyze what you'd like to improve. Maybe you're speaking too fast. Maybe you speak too slow. Maybe you sharing too much information that the patient get confused. Maybe you have to use some visual aids. Maybe you have to give a handout to the patient. Maybe some communication barriers, and be attentive to the nonverbal communication you can get from your patient. Because just because patients are not saying something verbally, you can get a lot of information from observing people's facial expression. How many times you have been interact with people, they didn't say anything, and you look at them like, you look a little confused. Seems that you're not quite understand what I'm saying, or I think you're upset, right? even
Right.
if they didn't say a word. So this is number one. So I think no matter what is the skill, what is the process, it starts with self-awareness. You have to be aware of what you need to improve. So once you figure out, okay, that is my top three. So there is so many different ways. You can do online training, you can do in-person training, you can hire a coach, you can have a mentor, you can really seek feedback from your closest friends, people who really know you. You can watch videos on YouTube, you can watch this video, you can read books. So there are so many different ways, but you have to identify what works for you. For some people, they are self starters, and perhaps just taking courses, listen to videos, listen to podcasts, buy books would do it. Some people need more assistance. They want someone to guide them. Is where a coach would be a great investment, and see as an investment on yourself on a long, short, and long term. So this is something that I would advise people to do.
Thank you, Isabel. Thank you so much for that. And just that, if you are somebody who is watching and you have joined a little bit late in this live, we are talking with Dr. Isabel Rambob. I'm talking today with Dr. Isabel, and she is the president of the American Association for Women Dentists. And we are talking on interpersonal skills because she is an expert. She's a coach in this field, and she has her own training services, Rambob Training Services. So, Isabel, I think can I take some more time of yours?
Of course, you're a great interviewer. I feel like I'm in a big hot TV show with this
Oh my God!
no experience. I
Oh
feel
no,
like I'm
no.
on a talk show with this celebrity from India.
Oh my God! No, that was too overwhelming for me. But thank you so much. I take all the
Wow, you
appreciation.
did this so well.
By the way, I want to request you to tell about the virtual fireside chats that you started, because I think yeah, I have been a part of it, and it is fantastic the way you are connecting people. And even I think just by attending two or three sessions probably that you started, um, uh, I shed a lot of hesitations which I had in certain areas. So please tell about that a bit, so that, and maybe I can just come back to two more questions and we will wind up, because I think we both can talk for hours, but for our audience it won't be very good.
And you know you're gonna be one of my guests. You're on my list for the fireside chat. Thank you so much for highlighting this. It started initially. My idea was to highlight women in dentistry. So I invite someone to share their story. So it's not like a lecture. It's not talking about a topic, but sharing their stories and inspire all the women. And I was like, okay, but this I want to really, because I love networking and I love to help people to be better networkers. So I
Right.
was like, okay, since they're gonna have this group of people online, why
Mm.
not embed it some time for networking? Because I love to connect people. And I did the first time, and I was like, I don't know how people are gonna respond to it, but the feedback has been so positive that now it's part of my template for the
I know.
session, to have this networking session where, because we meet on Zoom, so I send the participants to a breakout room,
Yes.
and
And I love that.
they get to know each other. And again, because of the technology, even
Mm.
though you're in a different country as yourself, and I really appreciate that, because it's really early for you, because we're doing the evening here in US. So it's early in the morning and you just set your alarm and you're there, and also show the commitment and the support. It's just so refreshing to have the support of other women,
Yes.
right? And so this is how this idea came about. And again, I think we have to fully embrace technology to expand our lack of knowledge, information, and our network. Absolutely.
Absolutely, absolutely. So, by the way, to my audience, if you have any questions, you can regarding or any problems that you face in your practice or while communicating, you can feel free to put it up right here in the live chat because right now Isabel is with us, so we can take those questions if they are very relevant. Definitely, we can do that. So, Isabel, just coming to the concluding part of our conversation. So, I would like to ask you one thing that I think you told a lot, but when it comes to networking and building relationships, as you mentioned, like you love to do that. Even I'm on the same boat with you, and perhaps that is how I could connect with you. So in that context, as a whole, suppose for any fresher, okay, how
Mhm.
important do you think these things are, like networking and building relationships? Particularly, I'm talking in focus with the dental industry.
Well, if you think about it, if you're in private practice, the base of your business, no matter if you're an associate or if you're a practice owner, is
Hmm.
a referral business. People gonna be referring patients to you,
Absolutely. Hmm.
either existing patients or your colleagues. So bigger your network, big is the possibility for people to be referring patients to you. Right there, right? It's just so important for dentistry. And it's something that we don't emphasize as we should,
Hmm.
particularly teaching dentist students the power of networking. And I even have a talk unlocking the power of networking. And I wrote a article when I have some steps to which I can share some of them.
Definitely.
So number one, you have to really have a strategy in mind,
Mm-hmm. Hmm.
right?
Hmm.
And so, why are you networking? Are you networking to attract more patients? Are you networking to potentially get a business partner? Are you
Hmm.
networking to get some investment to your practice? Are you networking to get referrals from other colleagues? Are you networking to promote your practice to the population at large?
Hmm.
So, why are you doing? That is number one. Number two is business cards. How many times I go to events and like, do you have a card on you? Particularly women. Why you not take your business card with you? I take my business card everywhere I go. Everywhere. Not only business events. If I
Hmm.
go to a birthday party, I'm taking my business cards. No matter what. If I go to the grocery store, I have my business cards in my bag. That is like something that I always have with me.
Hmm.
So you have to have your business card, right? Although with the social media, you can like, oh, you LinkedIn, let's connect on LinkedIn, but it's still that is a value of have a physical business card.
Absolutely.
Number three, okay, so you have a strategy, you have your business card, you have to have elevator pitch. So for people who might not know exactly what it is, so it's a very short statement, and ideally should be 30 seconds. It's like you just run into the elevator with someone, and then you're going to tell them and before the person has to leave the elevator, so approximately 30 seconds, who you are, what you do, and what you want from the person. So, hi, I'm Dr. Isabel Rambob. I'm the president of the American Association of Women Dentists. And let's say this person is from a dental company. And I'd like to discuss with you how can you be a corporate sponsor to our organization? Simple like that. Do I have your business card? Right? How
Awesome.
can I get a hold of you? Can we schedule a meeting? Simple like that.
Hmm.
And you might have to have different elevator pitch based on your role. So maybe
Correct.
uh, Hi, I'm Dr. Isabel Rambob. I'm a faculty member of the School of Dentistry. I teach behavioral dentistry, and I know you from the School of Social Work, and you teach behavioral modification. Can you be a guest in my course? So, can I have your card? I'm going to email you so we can set up the time you come to my class. So, based on your role, if you just have one role, it's fine. But if you, most of us wearing so many different hats, you have to
Yes.
have a customized
Hmm.
elevator pitch for each of the roles. So, hi, I'm Dr. Isabel Rambob. I'm the founder of Rambob Training Services. And I do like to know if you're interested to have me coming to your practice to provide a training to your team to make them more effective in presenting plans to your patients or really um, have a stronger social media presence, something like that. So, very simple, you're straight to the point. And you can even do this with your emails. So, when you reach out to people, hi,
Hmm.
I'm such such. I saw that you're doing such such, and I'd like to connect with you. Can we schedule a Zoom meeting on LinkedIn? You can send a direct message to people.
Right.
So these some of ways that networking is just so. I know that most of people they don't enjoy because I ask when I do. I have a talk on networking. And then
Hmm.
I do a poll, a live poll. I love live polls. It's great to connect with the audience and also gather some data. So, how do you feel about networking? I don't like it. I feel anxious. I feel nervous. But I was like, okay, whatever you enjoy or not, you have to embrace it because it's something so important as
Hmm.
a professional and particularly as a woman, that usually women feel a little uncomfortable, and
Hmm.
women who feel a little uncomfortable about tell about themselves. How many times
Yes.
I had been with a female colleague,
Hmm.
and they introduced themselves, and I have to add information. Hi, I'm Dr. Such Such, and she's the chair of such such department, and she's the assistant dean, and I have to give the title because they don't you had to sort of frame so people sort of have okay, it's not bragging, it's nothing wrong about telling your credentials.
Absolutely.
So
Absolutely.
make sure you introduce yourself not only with your name and with your title.
Hmm.
Absolutely, so you're already framing the conversation.
Thank you. I think it was a practical hands-on right here, right now, today.
I'm a
From
very practical person.
yes,
Everything I tell people to do I already did myself, so it's why I'm advising because I know it does work.
yes.
Yes.
So, just the last question of this day or the show to you today is that I think from very beginning it has been an inspiring conversation, and uh, at least my audience, I'm sure they would. And here, I'm sitting here. I have gathered a lot of points of inspiration from this entire conversation. So, and this is a question which I always love to ask my guests at the end, that what would be your message to uh, the freshers or people or the aspiring dentists uh, who are just starting their careers, and they are in a bit of hesitation, in a bit of confusion. So what would be one message to them from an expert like you, Isabel?
Number one, have mentors. And I'm saying not mentor, I'm saying plural, more than one. It's so important. And I'm sharing this message. If you a recent grad, if you have been practicing for 30 years, it's always beneficial to have mentors. So people that you can pick up the phone, send a message, meet up. This is the situation. Can you provide me with some guidance? And I do that. I have a group of people with different skill sets, with different life experiences, different background. That based on my need, I was like, "Can I take you out for lunch? Can we have coffee? Can I call you? Can and you mail them? Can we have a Zoom meeting?" So it's so important to have mentors. Number two, know your why. People come to dentistry, people come to the profession, to their careers for so many different reasons. So you have to really be in tune with why you're doing what you're doing and how this is supporting your overall goal, not only professionally, but as a person. Because you can be a dentist, a nurse, dental hygienist, dental assistant, but at the end of the day, you're a person with needs beyond your profession. So you have to align. And some people, a lot of stress and burnout is because people are not doing what they are designed to do, what their true passion. So this is really important. And number three is long life learning. Never stop learning, never stop exploring, and even inquiring and develop this inquisitive mind and question things. Because someone have done this for 30 years doesn't mean that you can be like, well, why are we doing this way, right? And there is a better way, a more efficient way, a faster way, easier way. So it's how we grow and how we make a really a change in the world.
Thank you, Isabel. That was very powerful. And I think, I don't know about the freshers, but this was a fresh win for me, at least for myself. So I took every message that you gave to the freshers community, whoever would be listening to this. So thank you so much for being here. And it was wonderful. And I think we are getting some showers of
Oh, thank
appreciation.
you so much. So
So
beautiful conversation with Dr. Rambob and Dr. Gargi, two energetic, enthusiastic women dentists. All the best. All the best to you. And thank you so much for joining us.
thank you. So I think we'll meet again, and I think I need to catch hold of you again and again to talk on different aspects because I think this entire episode it has opened our minds and like as we decided on the title that whether it is a need or hype, interpersonal skills is absolutely a must do and a need. That is the conclusion which I can make from this entire
And
conversation.
if you're still in doubt, you're missing out.
Yes,
Yes.
true, very true. You are missing out. Thank you, Isabel, for being here.
It was
So
my pleasure. Thank you so much for inviting me. And hopefully we're gonna meet in person soon. I don't know what part of the world, but we have to meet in person.
yes, yes, absolutely. I think that's the universe's call, and when it matches, we'll definitely meet. We'll definitely meet. Thank you then. So good night to everybody here, and have a great day, Sabul, because it's daytime for you, and you have to go. You have to go your on your schedule, work schedule. So thank you once again. Thank you everybody. Take care, and we will meet in another episode of Eclectica with somebody gorgeous, just like Isabel. Thank you. Bye.
Thank you.